I still remember, Owen, the effort to discredit Linus Pauling's vitamin C. And I don't want to dwell on that too much. There's too many positive things to talk about. But basically, what you said right before the break is fascinating. Apparently, most everyone has scurvy to one degree or another, whether it's subclinical, clinical, or whatever. It's there. And that's what's causing the damage to the arterial walls, the building up of the plaque, and the atherosclerosis. Now,
you've nailed it.
Pauling figured that out. How is it that vitamin C can somehow trigger the reversal of this plaque buildup? What is it about reversing scurvy that allows the plaque, the hardened artery, to become again more flexible and to open up?
Well, that's a great question, and brings to mind the work of Dr. Sidney Bush, an optometrist, who was looking at vitamin C in half of his patients to investigate its effect on an eye infection. And he just happened to notice, you can see with these equipment the optometrists use, these white atheromas that form in these microscopic arteries, and they're aware of them, and most optometrists don't think they can be reversed, and he noticed that in the group getting the vitamin C, he could see it dissolving. They were reversing. And he has published his work to show that, in his experience, most people the plaques will start to resolve by taking 10 grams, and it might take up to a month.
That's absolutely stunning news, and it ought to rock every cardiologist on their butts.
It really should. That's why I would rather. I think it's better to have cardiologists read this book because they have not gotten any of this in their training. I've been through a lot of their nutrition training. They never mentioned vitamin C once to them.
What nutrition training?
That's right. But even in the case of the therapeutic nutrition course that I attended, I audited it at a pre-medical school.
Did you really? Well, good. Bravo for you. That's real research. Wow.
Well, and it was like a Twilight Zone. They didn't mention vitamin C once the entire, so these kids go through this training, and there can't be anything there, right? Because I would be taught about it. There's no way that I wouldn't be taught. So it's sort of there's a vacuum, and they just assume that there's nothing there. And of course, there's a huge mountain underneath. Thankfully, that the Pauling opens up. But anyway, so Bush has seen that these soft atheromas can be reversed very quickly, but the harder calcified, over time, the actual plaque can become calcified, become harder,
right?
And that seems to take longer.
But it can be dissolved.
It looks like 2 years. Even in 2 years, he noticed that in one of his patients came back 2 years later and it was gone. So he has a before and after.
That's stunning. Now,
it is stunning. If you think about it, they can use this technique, no radiation, completely non-invasive, as long as your arterial system is connected to the rest of the body. You're getting a picture of how the plaque is forming, and you can determine your own dose. And if you like something else better, you could try that and see if it reverses your atheromas in your eyes. So he calls this cardioretinometry, and I get papers published, but he's running into the same roadblock that anybody in alternative medicine, including Pauling, ran into. Pauling, as a member of the National Academy of Science, was able to get his papers published in the proceedings. And that's how he was able to get around this barrier, but nobody else can get around the barrier and get their stuff published. So we could go on and on about that. It's sad. So, but it should be news.
Well, this isn't news. It's only the biggest. It's the biggest story in cardiology, probably of our lifetimes.
That's right. And it's what we see, and as I point out in the book, we see amazing reversals in a very short amount of time, and it's something that anybody who has five senses should be able to notice. Not only us. And yet, for some reason, it's not noticed at all by cardiology until they retire.
All right, if cardiology is treating patient X and they contact vitamincfoundation.org and they say, all right, send me some product, and they get the product. They can take vitamin C without any concern that it's going to somehow negatively interact with any other medication they're on, correct?
I believe vitamin C is that way.
That's my understanding.
I know of no reason,
no contraindications at all. It can only, your body will only use what it needs to do what it needs to do, and then it passes the rest off.
Well, and when they talk about it not having a lethal dose, where a lethal dose level kills 50% of their laboratory animals, and vitamin C not having a lethal dose, or neither does lysine.
Well, vitamin E builds up in the body too. You can take too much of that.
That's true. I mean, you can have it, but even if there is some toxicity associated with it. Compared to a prescription drug, it's non-existent. That aspect of it. There really isn't anything to worry about. I agree. There may be with some other nutrients. There isn't with vitamin C. In fact, for any heart patient, most of the drugs are accounting for the fact that there's low vitamin C in the body. And that leads me to Dr. Thomas Levy, board-certified cardiologist, also one of the world's experts now on vitamin C. He knew nothing about it, but he noticed that his patients who had their mercury fillings removed, their cholesterol invariably dropped within days.
All right, now what's that about? That's very interesting. I've got a couple teeth with amalgam fillings, and I said, all right, it's time. They're coming out in 2 weeks.
Good.
Yeah.
Yeah. Well,
what's that got to do with cholesterol?
Well, that's what he thought. He was wondering. So he went in and found the research that actually cholesterol is the body's detoxification, one of the body's detoxification mechanisms. The body produces more cholesterol in response to a toxic load. It turns out one of the primary detoxification mechanisms is vitamin C. That's where it got him into the literature of vitamin C, and he became one of the world experts. And he's a cardiologist. He analyzed all 27 known cardiovascular risk factors, and he was able to reduce them to one single factor: low vitamin C in the arterial wall.
That's incredible. Absolutely incredible.
Right. He wrote a book, Stop America's #1 Killer, which is really a book for cardiologists. It's by a cardiologist. And, it has amazing facts that support the Pauling theory. For instance, plaques form on the outside of the heart, in the coronary arteries. The plaques do not form on the inside of the heart, in the coronary arteries. Think about that for a minute.
All right, the arteries are exiting the heart, too. The veins bring the blood back to the heart.
Right. But yeah, it's generally, atherosclerosis happens in arteries, and that's where the blood pressure is highest, not in the veins.
Well, it's because it's just leaving the heart at the highest point of pressure.
That's right. But think about this. On the surface of the heart, that's where your left descending, the LAD artery and all these other that get clogged are. But there also are coronary arteries within the heart itself. They don't get plaque. It's only the arteries on the surface. I'll let that sink in for a second. But
yeah, let's explain that when we come back.
Okay.
Yeah,
explain. And
really,
basically, it's a support for the Pauling theory.
All right. Wow. Well, Dr. Pauling speaks through Owen Fonorow.
I wish.
Well, he does. I hear his voice.
I guess there's some truth to that.
Yes, there is. We'll be right back with more. You can order the book by simply going to vitamincfoundation.org. The book is, 200 pages, a little over. Very easy reading, very accessible information, and it's right there. I mean, this information will literally save millions of lives if it is used.
That's
millions. There's no joke. So, okay, I want to go on the product. I want to go on vitamin C. I go down to my local store. I'm going to buy some kind of vitamin C product.
You want to let's say that you're suffering, and you want to see if this is going to work for you. And you do go to. I'm not sure where you were headed, but you go to some local store and you buy vitamin C tablets, preferably with the least amount of fillers as possible. It's ascorbic acid, 500 milligrams. And you'll also see lysine tablets there, thanks to the University of Chicago and their work on, I think it was some kind of a herpes complex or something. So you buy lysine tablets and you buy vitamin C, and you begin by taking one of each every 4 hours. And then if you do that and you don't get any gas or diarrhea, then you go to 2 pills every 4 hours. And that's a gram times the time you're awake. And you go up until the point where you start to experience gas and diarrhea. And that's your tolerance level. It's not a guarantee that it's going to be enough.
And then you back down from there.
And you should start feeling, depending on your issues, you should start feeling better within 10 days.
That's an astonishing suggestion. That somebody with is it angina or angina? Whatever.
Yeah, that's a good question. I'm a writer. I'm not a speaker.
Angina.
I've heard it both ways.
I'd say angina. All right.
Yeah.
So you got heart pain. You got occluded arteries. You got problems.
Right.
You're suggesting, and forgive me for belaboring the point, that people are going to feel something after 10 days better. That's amazing.